This lecture is a quick review of the nursing process, an integral tool used every day in patient care. The nursing process is a framework that enables nurses to create care plans and to look at what has been done, what should continue to be done, and what needs to be changed to assist patients to a state of well-being. The nursing process is usually described as having these steps: assessment, nursing diagnosis, planning. Some schools include outcome identification as a separate step after the planning phase, implementation or nursing interventions, and evaluation. You all are CPR certified and therefore have been instructed in the use of an automated external defibrillator, or AED. Since this material is familiar to you, we will look at the nursing process in terms of deciding to use an AED. What is the first thing you would do if you are walking a patient down the hall and the patient falls to the ground? Right, assess the patient. What would you assess for? What do AED guidelines say to assess? Let's check this video to see if we are doing it right. You assess the patient to see if he is okay. Based on your assessment, he is not. You check circulation first. You find the patient has no pulse.
Code blue!
You quickly think which nursing diagnosis would apply to this patient. The North American Nursing Diagnosis Association, or NANDA International, has a long list of choices, but the logical NANDA diagnosis for a patient with no pulse would be decreased cardiac output. Now you will move to the third step of the nursing process, planning. The best way to remember planning is to substitute the word goals or outcomes. What is the goal for this patient? The patient has no pulse. So the goal is: the patient will have increased cardiac output as evidenced by a strong pulse after emergency intervention. The next step of the nursing process is implementation, also called nursing interventions or nursing actions. Interventions are all the things the nurse does, arranges for, delegates, and so on to reach the goal. Watch the video and list all of the interventions that healthcare team members do to help the patient reach this goal. The patient will have a strong pulse after emergency intervention. You may have to watch the video several times to identify all of them.
If a cardiopulmonary arrest is confirmed, turn the automatic external defibrillator power on and place the adhesive defibrillator pads on the client's bare chest. One pad goes below the left breast and the second pad goes just below the client's right collarbone on the ribs. The machine will alert the user to pad connection problems and suggest a remedy.
AED pads are on.
The operator's voice and the client's ECG will be recorded on a removable digital data card inside the battery compartment. The recording begins when the power is turned on and continues for a maximum of 30 minutes. The automatic external defibrillator will instruct you to deliver a shock in 4 ways. 1. A voice prompt to deliver a shock. 2. A steady tone. 3. The shock button flashing. 4. A screen prompt to press the shock button. Say, "All stand clear." No person should be touching the client or the surface they are lying on. The client cannot be lying in liquid. Allow the automatic external defibrillator to analyze the heart rhythm. If another shock is advised, the automatic external defibrillator charges to prepare for shock delivery. Check the monitor to verify that a rhythm is either sustained ventricular tachycardia or ventricular fibrillation, and that the client does not have a pulse. Clear the client and press the shock button. Again, allow the automatic external defibrillator to analyze the heart rhythm. This client is now in sinus rhythm. Assess the client's pulse, blood pressure, and breathing while maintaining the airway.
Here is a list of the interventions you would perform for this patient with decreased cardiac output. If this were not an emergency and you were writing a care plan, you would list all of these interventions for the patient to ensure continuity of care. The final step of the nursing process is evaluation. During the evaluation step, you look at or evaluate all the previous steps of the nursing process. Assess the patient again. Is data the same, or is there more or different information to consider? Look at the nursing diagnosis. Does it still apply to the patient's condition? Review the plan, goals, and outcomes. Have they been met or not met? Determine whether to continue the care plan as is or to make changes. Determine which interventions worked and which did not. Consider whether the patient's condition has changed, whether the care plan should change, or whether interventions should be added or omitted. Evaluation is also known as reassessment, illustrating how the nursing process is continuous and interactive. It may lead to new findings and further nursing diagnoses. In fact, in most clinical situations, several nursing diagnoses exist, and they must be handled in priority order. In this case, since the patient is unconscious, we can continue to apply the nursing process like this. Assessment. Patient is unresponsive and unconscious. Nursing diagnosis. Altered tissue perfusion, cerebral. Plan, goal, or outcome. The patient will have increased cerebral tissue perfusion as evidenced by a return to consciousness. Interventions. Since we already know that the client has decreased cardiac output and the heart is not beating, we can judge that the brain is being starved of blood. Compressions must be provided to move blood to the brain. Evaluation. After a cycle of compressions, reassess the patient to see whether consciousness has returned. Let's sum up the steps of the nursing process one more time. Assess a patient to determine if there are any problems. Based on those problems, select appropriate nursing diagnoses. From there, make a plan, also known as goals or outcomes, for each diagnosis. List all the actions needed to implement each goal. Perform the interventions. Evaluate the patient. When reassessing, see if the nursing diagnoses still apply. Judge whether the plan and interventions are meeting the goals. Change the nursing care plan as the patient's needs change. The nursing process is a continuous and ongoing method of addressing patient problems and assisting patients to wellness. The nursing process never stops as long as a patient is receiving nursing care. This lecture discusses the many considerations that are part of the delegation process. The American Nurses Association defines delegation as the transfer of responsibility for the performance of an activity from one person to another while retaining the accountability for the outcome. Delegation can free nurses to focus on more complex patient care needs. It also develops skills of assistive personnel and helps contain costs for healthcare organizations. According to the National Council of State Boards of Nursing, UAP, also referred to as NAP or Nursing Assistive Personnel, are any unlicensed personnel, regardless of title, to whom nursing tasks are delegated. UAP have many job titles. Some of the more common ones are nurses' aides, certified nursing assistants, and patient care technicians. The delegating nurse must know the job description and match the skill level of the UAP to the task being delegated. Training and experience are both important factors in deciding which UAP can safely perform a task. Practice acts and regulations about delegating vary by state. The licensed nurse is ultimately responsible for the nursing care that is delegated. The UAP who receives a delegated task may not delegate it to another person. Delegation decision-making is part of the planning phase of the nursing process. Client protection is the fundamental principle when making the decision to delegate. Delegation includes all of the following elements: evidence-based practice, creating a scientific basis for nursing decisions. Boards of nursing, which write guidelines for delegation decisions. State practice acts that create regulations. Licensed nurses who are accountable for the nursing care provided. Policymaking and procedures related to delegating. Ensuring that standards of care are met when delegated tasks are performed. Utilizing UAP, who help nurses provide complete nursing care to the client. UAP assist nurses. They do not replace them. The 5 rights of delegation address crucial elements in decision-making about delegation. Delegation increases the scope of liability for licensed nurses. Nurses are not directly liable for acts of negligence by UAP. However, if they are directly supervising a delegated act, when the UAP commits a negligent act, they may also be held liable. The first delegation right is the right task. When deciding which tasks can be delegated, nurses generally include tasks that occur often in daily care, tasks with predictable results and minimal risk, tasks with an unchanging procedure, tasks that do not require nursing knowledge and professional judgment or complex application of the nursing process. Only nursing interventions can be delegated. Examples of appropriate tasks for delegation are taking vital signs, helping clients with transfers and ambulation, bathing, feeding, and bed making. Tasks that cannot be delegated are essential functions of nursing, such as interpreting data and creating care plans. Skilled nursing tasks, like administering parenteral medications, also should not be delegated. The right circumstances for delegation require nurses to assess the client's health status, analyze the data, and identify specific goals and nursing needs. The nurse must be aware of resources, matching the complexity of the activity with UAP competency and the level of supervision available. Delegation is based on the client's needs and goals at the present time. When the client's condition changes, the nurse must reevaluate nursing care needs and adjust the tasks that are delegated. The right person aspect of delegating means that nurses must be sure UAP are competent and understand the task related to the particular client. Nurses must be sure that they themselves understand and maintain professional standards. Nurses must evaluate UAP performance and take steps to remedy failure to meet accepted standards. Even if a task can legally be delegated, the nurse must still determine if the task can be delegated to a specific UAP caring for a specific client. Right directions or communication can be oral or written. They include stating specific data to be collected, the method of collection, and timelines for reporting. Providing directions and clear expectations of how the activities are to be performed. Naming the expected results or potential complications, including a timeline for reporting back about them. Right supervision means that delegating nurses must monitor and evaluate the performance of specific nursing activities or assign supervision to another licensed nurse. To supervise directly, the nurse might monitor the UAP's performance, obtain and provide feedback, intervene if necessary, and ensure proper documentation. The delegator may also supervise the delegation process indirectly by evaluating the client after the activity has been performed. There are some common delegation errors. Underdelegation may stem from lack of trust in UAP. It may also occur when nurses think they should be able to do the whole job by themselves. Overdelegation is a second common delegation error. Some managers overdelegate because they are insecure about their own ability to perform a task. Others do not take time to organize work efficiently. In either case, overdelegation increases stress and can decrease productivity among staff. Improper delegation includes delegating tasks at the wrong time, to the wrong person, or for the wrong reason. It includes delegating tasks and responsibilities that are beyond the ability or scope of the person to whom they are being assigned. Several tools are available to guide the nurse through decision-making about delegation. Decision grids and decision trees can be found in a variety of nursing textbooks or on the ANA or National Council of State Boards of Nursing websites. Supervisors or mentors can also be a source of guidance and direction when considering decisions about delegation. Delegation of tasks to UAP is essential to ensure that all necessary nursing care of clients takes place. If appropriate guidelines are followed, delegation to UAP can be a reasonable, safe, and resource-efficient method of extending nursing care. Delegation empowers UAP, builds trust and efficiency, and strengthens healthcare teams.